Hi everyone, my name is Dr. Bridget Muller, and I'm pleased to be hosting today's conversation as we officially welcome Dr. Tim, who is the newly appointed Executive Director of Africa Digital Health Network. Dr. Tim, congratulations.
Thank you so much. Happy to be here and as I take on the new challenge. Yeah.
Amazing.
Yeah.
So I want to start with the first question, which is probably not super obvious, but I've been wondering, how does a dentist end up in ADHN? Could you tell us how your journey, the whole trajectory has been?
I think it's been a journey of many firsts, if I may say for myself. And I started off as a dentist in Nairobi, set up a practice that's still continuing.
Yes.
Easily one of the biggest in the city. From there, I joined the Kenya Dental Association, where I believe most of my leadership was honed. I have had the privilege of working under fantastic leaders and men and women who've gone before me. So I wouldn't credit my being here to purely personal or individual effort. It's been the benefit of that. People who've gone before me, experiences I have picked, and that's how and why I think I'd say I'm ready for this next challenge. Down at the association, what we managed to do was, it's a member organization. So we took care of the members, corporatized it, introduced new things in how associations are done, and the Kenya Dental Association, where I served as an assistant secretary, secretary general, and eventually the president, is one of the oldest associations in the country. Right before independence, we got formed, and actually registered, not formed, registered, and we came from the East Africa community where there was an association, and given the development of the time then most of the apparatus was retained in Kenya, and that's how the association came to be. From there, I joined the Kenya Healthcare Federation, another business member organization, as the chief executive officer, and those were very determinative years for my career and myself as a leader. We saw a lot of change happening in the healthcare landscape in the country, in the region, and consequently in the continent. What I carry with me from that stint is business member organizations like the Federation and now ADHN. We must not forget the why.
Yes.
And the why is the members. We must tell their stories. We are the ambassadors. We are their advocates. So it's important that we do tell the stories. And what I am really keen on is progress.
Yes.
In the continent.
Amazing.
The reason I say that is because when you look at technology, when you look at where the continent is headed, a couple of things come to my mind. One is the continent Africa will have a quarter of the world's population in not so long. We have majority of the world's arable land. We do have fantastic harbors. Among the deep harbors in the world are in Africa. And what brings progress in any society? A few things come to mind. And I'll lean a little on tech, because that's what we basically be underwriting the ADHN. And this is tech in healthcare. When you look at social sciences, education has been pretty impervious to technology. Not in how it's delivered, but the interaction between the teacher and the student has largely been manual.
Yes.
All right. There has to be two people for that delivery to happen.
That's true.
Healthcare, the advancements have been so huge that in the middle of the 19th century, you would bite the bullet, and a doctor would do a procedure on you without anesthesia. That's where the phrase "bite the bullet" came from. And the doctor had 2 minutes to do that. Otherwise, the patient would get into shock, and of course, we know what that brings. Now, we have the capacity as healthcare workers to operate on a lady who has a pregnancy and a child who needs intrauterine care way before they're born. We close up and wait for the child to be born. Those are the advancements you're talking about. We are doubling our medical knowledge every 2 years. And for Africa to be healthy long enough to enjoy the advancements of that come with civilization, then they must be underwritten by a healthy population.
Amazing.
Yeah.
So thank you for that. I think you've brought about how digital health will actually support in increasing access to healthcare, and not only just access, but delivering more precise and better effective health outcomes. Now that you've mentioned that, how do you see ADHN in the next 5 years? As you've mentioned, Africa's population will be like 25% of the world. That's a big population, right? How do you see ADHN being able to support in increasing access to better quality healthcare in Africa? How do you see ADHN being able to play that role?
I think our dot in the horizon as ADHN is we need to be the unsung hero in Africa's story. What do I mean by that? I mean that when we measure progress of any society, we look at how society treats its most vulnerable.
Yes.
And we have very many vulnerable people in the continent.
That's true.
Success for me would look like that the people who do not know ADHN exists would say we have had a benefit because one of ADHN's members has brought a solution that has made life easier for us. All right? And here it's not the pomp and color.
Yeah.
It's those small and soft stories that are told and people say, ever since this solution was introduced, my life is better.
That's true.
I'm healthier. Solutions are coming to me faster. There's this predictability as well of what I am seeking, and I do want those solutions to be delivered by my members.
Yeah.
That is what I look at success like. I had mentioned the population of the continent. When you look at how much we contribute to global trade, and then let me just say GDP because that's what is generally measured. It's small. It's less than. It's still single digit.
Yeah.
Right. Where at the end of the World War, the US contributed 25%. All right. Right now they're still contributing the same. All right. Despite the massive expansion, their shares largely remained the same. What is Africa's story?
Yeah.
So ADHN members must contribute to the economic success of the continent through solutions that keep its people healthier for longer. Now, there are two things that will happen. There is a success we are going to enjoy because of if that progress goes as we see it to be, but there's a flip side of it. The flip side of it is when the people who what are they called, the early men, when they invented hammers. The Stone Age guys. Actually, you have it right. Thanks. So you have it right. So when they invented hammers, they could hunt. But they also started beating each other.
That's true.
Right?
Yeah.
So there's always the flip side of the coin. So we have a young population.
That's true.
That can be healthy for longer. So if that is what we are projecting to happen, what are these people going to do?
Yes.
All right. So our solutions must, one, keep them healthy.
Yes.
Must keep them economically productive.
100%.
But more importantly, give them jobs.
100%.
They must be economically productive through the solutions of our members. So that is what success will look like for me, and that is my dot in the horizon.
Amazing. So not seeing health just as a disease, but health on the whole, economical. I think that's how we should probably view it.
Yeah.
It's a good thing you've mentioned about your members and the solutions that they are going to bring. Now, one of the challenges that I've seen with innovations, especially in the digital sector, is that they don't always go up to scale, right? They start as pilots. After 2-3 years, you're not seeing them actually, let's say in a country like Kenya, they don't end up going to the whole nationwide range. So what is ADHN actually going to do? I mean, maybe partnering with governments, maybe you can share more insights in that to ensure that your members, when they come up with these amazing solutions, that they can actually go to a wider scale and they don't face some challenges.
I want us to have an all of value chain approach. An all of value chain approach. So the continent does not have a volume problem, right?
100%.
We may struggle with value.
Yes.
All right. We don't have a market problem. Right? So these people who are coming to the market, I dare say that the demand is not the problem.
Yeah.
But how are we structuring the demand? How are we organizing our markets?
The regulations in between.
So that is there's a big discussion to be had around that, yeah. And like I mentioned, technology is progressive, right? It increases. It's incremental in the way it's developed. The advances are better today than they were yesterday, and this happens in the context of institutions. All right, institutions change. Right, we talk about institutional change, technology progressing.
Yes.
So change can be positive or negative as well. But in the grand scheme of things, institutional change must be progressive when you look at it over a long timeline. So one of the things that I would hope for in my time here is that we are able to build a culture in the institutions who will be our members, or help them build that culture that will promote progressive change.
I agree.
Now, we do have members who are starting off. They will need funding, they will need a good runway for them to try their solutions. In 2025, one of the Nobel Nobel Prizes in economy was to a gentleman called Joel, I forget his second name, but he talks about how progress happens and the importance of culture. Now, tying it to what we are talking about, the people who will need the money, the institutions that they are coming into, giving them a runway, we must promote an environment where it's safe to make mistakes. All right? And that environment where it is safe to make mistakes means that I am willing to try and try and try again until you get a solution. When you look at when society has progressed the most, and when you look at those curves, they look like hockey sticks at times. A few points when electricity was introduced, when organic chemistry became a thing, Edison, when he was doing the light bulb, and he was asked, how did you get here? He said, I know 5,000 ways not to do on how not to do this, meaning that he was in an environment where it was possible to fail, but not catastrophically so. So the continent, and for people like those, must be given an arena to try their solutions, build those solutions to scale. That is why at ADHN, governments are our members, all right?
Perfect.
And governments give that environment through one, allocation for money for research and development, regulatory harmonization that ensures that such entities are protected, assuring demand, all right? Governments world over are big purchasers, so they can assure certain demand through policy incentives, through policy stability, all right, and at times just buying the solutions outright. So that is the mix of stakeholders that we have, and my hope is that we will be able to bring them together and organize our markets in a way that these people have a path towards the solution. We also do have people who have already done their startup phase. They are now scaling up. Again, they also need patient capital. So financial institutions must be part of the people who become our members, so that they're able to understand what is needed in healthcare. When capital comes into healthcare, how should it behave? what is a tenure like of the credit? What is the cost of this credit? How do we cost it? Yeah, do we begin now to look at different credit indicators? Right, this is a developing market. We have this number of what can we use? Maybe cancer cases.
Yeah.
What does that look like from a commercialization point of view? All right, we are now fighting with Ebola. Do we have people who have solutions? One, in passing information to people so that there is no information asymmetry, everyone is on the same page. Do we have people who can give us solutions that can model the spread of the disease?
Yes.
Do we have solutions in digital health where we can have dashboards, maybe, So that's my view of it. And ADHN will be a digital dashboard in a car. All right. The reason I say that is when the car was invented, we didn't have a dashboard. Certainly, right? We had a few gauges that showed important things, but now we do have cars that have a screen from one door to the next.
Yes.
That is ADHN.
Okay. And it keeps on evolving. Amazing.
So ADHN must keep its screens clear. It must keep its information crisp. It must keep its information relevant, so that when the drivers of healthcare, who are the inventors behind us, who are the governments, and ultimately the people of Africa, look at us, they can say that we are doing a good job.
Amazing.
Yeah.
I don't know about you, but I feel quite reassured having Dr. Tim steering ADHN for the next couple of years. Now, as we wind up this session, Dr. Tim, I'd like you to give a call to action to your new members who are going to come on board on joining you.
One is ADHN cannot do this alone.
True.
I cannot do this alone. We have a fantastic board, certainly. There have been men and women who've carried the vision up to where we are now.
Yes.
And as I join them in driving the ADHN vision and agenda, we do need everyone on board. We do need the communities on board. We do need our governments on board. We do need the private sector on board. We need people in academia, people in research and development. We need the youth on board, and certainly do need the women on board. And my call to action for all of us is, you cannot drive on a road without at night without light.
Yes.
So we want to be part of the people who provide this light and give the assurance of the drive we are about to have. For us to deliver healthcare for a quarter of the world's population, it cannot be done any other way at scale other than using digital health solutions. So that's why ADHN is important, and that's why the course that we are embarking on is certainly important, but it will be meaningful if we do it all together.